Welcome to Snackable Health with Gibson and Kohli, and we're talking about COVID. Is it endemic yet, Payal?
It's $1 million question, Mike. Everybody's asking it. And there's no such way to sort of flip a switch and say, okay, now it's endemic. But there are characteristics of a virus that really suggest that it started to become endemic. The first is that it's present all the time. I think COVID does meet those criteria for sure. The second is that it has predictable levels. Now, notice I didn't say it has to be a low level. So, for example, the flu, which we know is endemic here in the United States, it goes down during the summer and then the activity goes up in the winter. So it can be variable levels, but they have to be sort of predictable and following a predictable pattern. And that's where I don't think we're there yet with COVID, because we're still seeing cases go up almost in an unpredictable way in pockets across the country that we may not expect.
So is there any sense of when it might be endemic, or may it never be endemic?
I do think we'll get to being endemic, especially as more of us get infected and develop some degree of immunity that helps to kind of create that steady state level. One thing that's a wild card with this virus is the rate at which it mutates so quickly, and the fact that some of the variants that it's had have been pretty bad. So assuming we stay with this particular variant, the Omicron variant, which is much milder, and we continue to follow the same behavioral patterns that we're following now, I would hope that we start to get towards an endemic phase later this year. But if we change our behavior drastically, or if a new variant emerges, or we see a lot of changes in people's immunity because that new variant is not, the vaccines are not protective against the new variant, those are things that might change whether it becomes endemic or not.
Great. Well, thanks for the update, and thanks for joining us here at Snackable Health.